Hello, my name is Flavia Munn and I'm a senior writer on BMA News. In recent months, the magazine has been inviting senior BMA figures to be guest editors. This week is the turn of BMA Junior Doctors Committee Chair Andy Thornley. He's here with me today to introduce the edition of April the 4th, which focuses on maintaining the quality of junior doctors' training under the European Working Time Directive. Welcome, Andy.
Good morning.
Could you first of all tell me why you chose to focus on this issue for your guest editorship?
Well, I think the European Working Time Directive is very important for junior doctors this year. We've had almost 11 years to prepare for the implementation of the 48-hour week in August this year, and we're increasingly concerned that the preparations aren't running as smoothly as they should. One of the big concerns for junior doctors is around training. Now, this is something that the BMA, along with other trainee organisations, has been talking about for some time. We're particularly concerned about training in the craft specialties, so surgical specialties and other specialties where you need to develop skills to deliver high quality care to patients. And that's because these specialties require time and experience with patients to develop the skills necessary. We're also concerned that when you look at it, the NHS as a whole, there appears to be a lot of juniors who aren't compliant with the 48-hour week ruling. In particular, just this week, we've seen the release of figures that show a third of junior doctors are still working in non-compliant posts, and that's of concern to us.
And what specific solutions does the JDC have to ensure the quality of training is not adversely affected by the reduction in hours?
Well, we've got a whole raft of solutions that we'd like to see introduced across the NHS. In particular, we've got a range of solutions looking specifically at the quality of training that juniors receive. So that will be things like seeing the reintroduction of training lists. Now, we know that 10, 15, 20 years ago, most junior doctors in craft specialties would have the opportunity to perform a training list once or twice a week, and these would be specific lists where they'd have a trainer looking over their shoulder, teaching them how to do things. Increasingly in the most recent last few years, we've seen these training lists disappear, and I think that's a very detrimental thing for junior doctors' training. This is just one of the things that would like to see changed in terms of quality of training, but there are lots of other specific things as well. For example, I think we need to realistically look at the duration of training. Now, over the past few years with the introduction of MMC, we have seen a move to try and shorten training, and I think in some areas that may well be appropriate, but in areas where junior doctors aren't gaining the competencies and confidences that are necessary, they really need to look at lengthening training. I think if there's evidence that juniors can't get those competencies and can't get the confidence, then training does need to be prolonged. But that needs to be evidence-based, really. One of the other areas that we'd like to see changes is we'd like to see focused consultant expansion. Now, we know that consultants deliver very high-quality care to patients, but consultants are also responsible for delivering high-quality training to juniors. And I think there are some specialties where we really need to look at how service is delivered. I don't think it's sustainable for the majority of service in the NHS to be delivered by juniors. I think over the next few years we will see a decrease in the number of junior doctors, and that's simply because we appear to be overproducing the number of hospital CCT holders. And that means that the service needs to look at how it delivers care to patients. Now, the best way of doing this is with a consultant-based service, so we'd really like to see expansion in consultant numbers in specialties where there is evidence that it's necessary.
And how are NHS targets affecting junior doctors' ability to gain high-quality training opportunities?
Well, we've heard from many trainees that they're finding that lists are under increasing pressure. I myself have experienced an incident where I was trying to perform an electrophysiologic study on a patient, and I was taking some time to do it because I'm only just learning the skills required at the moment. Unfortunately, because of the pressures on the list had been overbooked, so there wasn't the time for me to actually learn the skills that I needed, and my consultant felt that he didn't have the opportunity to let me learn, essentially, and that he had to take over the case at a relatively early stage so that we could get through the work that was necessary. And this has largely been driven by the 18-week target, so trying to get patients through the doors as quickly as possible. Now, obviously, patient care is vitally important to junior doctors, consultants, and to patients. And we don't really want to see major impacts on patient care, but it's important that junior doctors have the opportunity to learn as well. And sometimes I think targets can remove that opportunity.
And how can the BMA help doctors who are concerned about their working patterns?
Well, we know that many junior doctors are going to experience changes to their rotas and their working patterns over the next few months to make them compliant with the European Working Time Directive. There are very clear guidelines on how these changes should be introduced. In particular, junior doctors on the rotas must be consulted about any changes before they're introduced, and essentially that junior doctors need to agree to these changes. Now, we know that in many trusts this process doesn't happen, and that junior doctors are just told that their rotas are changing without them actually being involved in the changes. We think it's imperative that juniors are involved in these processes, as this is how training can be maintained with changes in rotas. If during the current contract campaign we do actually have a section on our website on both how rotas should be changed and the processes that trusts need to go through, and also on what juniors can do if they feel that their training has been negatively impacted. And I think it's important that juniors do stand up and say when things are not happening as they should. It's important that juniors make sure that changes to their rotas happen with following proper procedures, and it's important that juniors make sure that their training is maintained. One of my concerns is that junior doctors essentially are in relatively short-term posts, so there is a tendency for people to say, well, you know, I'm only here for 6 months. If I grin and bear it for that length of time, then I'll move somewhere else. I don't think that we can tolerate that kind of attitude anymore. I think junior doctors need to say this isn't good enough and stick up for themselves.
For further information on any of the issues raised, please look at the BMA website or the Junior Doctors Handbook, or if you have a specific member-related query, then please contact Ask BMA.